Hello, welcome to HeyDoc with me, Dr. Kady. I'm a board certified family doctor. Welcome to HeyDoc. On this channel, we address all things related to fertility medicine, women's health, as well as pregnancy related issues. In this video, I'm going to address how to manage gestational diabetes with dietary measures. Just so that you know, on this channel, I have a video about what gestational diabetes is. I also have a separate video on how gestational diabetes is managed with medication. But gestational diabetes does not always have to be managed with medication in all patients. Some women with gestational diabetes are only managed with dietary measures throughout their pregnancy. In this video, I'm going to be talking about what these healthy eating tips are in order to support you through your journey with gestational diabetes. Now, another thing that you must note is that if you have gestational diabetes, or even if you were diabetic before you fell pregnant, these healthy measures, even if you end up having to take medications, these healthy eating tips will still be helpful and relevant and help you to keep your blood sugar within the target levels. Briefly, what is gestational diabetes? Well, gestational diabetes is diabetes that occurs during pregnancy. So that woman did not have diabetes before, but because of the hormonal changes that happen during pregnancy, that woman's insulin level is no longer able to maintain her blood sugar within the appropriate ranges. What makes gestational diabetes different to the other types of diabetes is that once the baby is born, the blood sugar levels return to normal and the woman is no longer considered to have diabetes. Now, the reason I have this board out is to show you the portions that you should be eating as a woman with gestational diabetes in order to keep your blood sugar levels within target. Again, a quick reminder of something I addressed in the previous video is the target blood sugar levels. If you are a woman with gestational diabetes, the target blood sugar levels you should be aiming for is fasting blood sugar levels should be 5.3 or less. 1 hour after eating, your blood sugar levels should be 7.8 millimoles per liter or less. 2 hours after eating, you should be aiming for a blood sugar level of 6.4 millimoles per liter or less. But for those of you who are following me and have already been started on insulin, either because you've developed gestational diabetes or you are a diabetic who then became pregnant, please remember you must aim to keep your blood sugar level at 4.0 millimole per liter or higher. Otherwise, you may suffer a hypoglycemic event. So what does a balanced meal look like for someone with gestational diabetes? Every meal should include lean protein, healthy fats, complex carbohydrates, and non-starchy vegetables. I'm about to show you an example of what your plate should constitute of for most meals. 50% of your plate should be non-starchy vegetables. 25% of your plate should be made out of healthy carbohydrates, and the final 25% of your plate should be made out of lean proteins. This is what you should be aiming for your plate to contain for almost every meal. 50% non-starchy vegetables, 25% healthy carbohydrates, and 25% of your lean protein. Just for you to have a closer look. Now that we know this, let's look at some actual foods that you can use as the ingredients to some of the recipes that you will be making during your pregnancy. This is it, ladies. On this kitchen top, I have food items that your diet should be containing if you have diabetes in your pregnancy. I also have some bonus items that I want to show you that you should be aiming to avoid with diabetes in pregnancy. Let's take a closer look at some of these items. We'll start with our vegetables. When I mention non-starchy vegetables, I'm sure some of you are asking, what are the non-starchy vegetables? So the type of vegetables that you want to be staying away from with diabetes in your pregnancy are the sweet potatoes, the pumpkins, and your sweet corn. All these that are considered to be very starch-loaded, sugar-loaded carbohydrates you should try to avoid. Now, if you must have some of these starchy vegetables, you should aim to have a very minimal amount and only once a day. So we make away with these starchy vegetables and we keep them to the bare minimum if we must have them. Now, on to the vegetables that we actually want. These are our non-starchy vegetables, which remember we said should be 50% of our plate portions. So in detail, we have cucumbers, broccoli, bell peppers, carrots, get you some mushrooms, but of course avoid these if you are allergic. We've got sun-dried tomatoes, fresh tomatoes, beetroot. Now, I mentioned earlier in the video that your diet should be including healthy fats. Some of the healthy fats that your diet must contain, you will get from avocados. With your meals, you should be aiming to have avocados wherever possible because they give you unsaturated fats that don't just help you with diabetes in your pregnancy, but are also helpful for your cardiovascular health. Another very important non-starchy vegetable that you should be including is kale. And I don't have it on here, but you should also be considering vegetables like spinach, zucchini, and so on and so forth. Okay, so those are the vegetables you should be aiming for. Now, let's look at our healthy carbohydrates, also known as our complex carbohydrates. The reason why complex carbohydrates are important in gestational diabetes is because they cause a smaller and a slower rise in blood sugar, thereby you needing a smaller amount of insulin in order to break these foods down. So what are considered to be the complex carbohydrates? We have got the brown rice, we've got bulgur seeds, we have barley seeds, and as part of these complex carbohydrates, you will also have quinoa. Now, another seed that is not necessarily a complex carbohydrate that I want to mention because it has a lot of nutritional values in pregnancy also are chia seeds, okay? Chia seeds can be included in your smoothies, in your cereals, sometimes in just your beverages, and chia seeds are ideal to have as part of your diet in gestational diabetes. Another complex carbohydrate that it would be impossible for us not to mention are the oats. Oats are important because not only do they have a low glycemic index, but they are also high in fiber. So as well as helping you manage your gestational diabetes, oats are important because they help you prevent constipation in pregnancy. And constipation will obviously lead to other problems like hemorrhoids, okay? So oats are also ideal. Let's move on to talking about our proteins, the type of proteins that we want in our diet. Proteins will include the pulses, okay? The beans, the chickpeas, the black-eyed peas, the pumpkin seeds, and we also have lentils, okay? So the 25% of protein will be obtained from things like lentils, chickpeas, white beans, broad beans, and as mentioned before, pumpkin seeds. The pumpkin seeds are great because they give you that great crunch as well as giving you your healthy fats. Now, let's talk about the fruits. Fruits are great. Now, I would say no fruit is out of bound for gestational diabetes, but you must be careful the times at which you're eating the fruits and the quantity of fruits that you are eating, okay? If you are having a big mango at 9 p.m.